Introduction to Nursing Concepts, Medical Terminology. This is Martha Olson discussing the nutrition unit. The suffix IC means pertaining to. When we discuss terms related to the gastrointestinal system, we can refer to gastric, meaning pertaining to the stomach, pyloric, pertaining to the pylorus. Peritoneal is pertaining to the peritoneum, hepatic pertaining to the liver, and pancreatic pertaining to the pancreas. A prefix mal means bad or abnormal, malabsorption, malnutrition. Absorption into or across the tissue. Most absorption is in the small intestine, and then from there goes to the bloodstream. When we have a person with malabsorption or malabsorption syndrome, they can become depleted with their nutritional status very quickly. Two types of nutrition we need to talk about: enteral nutrition, and the other one is parenteral. They're very opposite, and I want to compare and contrast them. Enteral nutrition is nutrition that either goes through the nose down into the stomach, or they have a tube into the stomach to provide the nutrition. Gevity is the most common type of fluid or nutritional supplement that we administer into the stomach. When a person gets enteral nutrition, it's usually more of a long-term. You can use this in home care or the long-term care facility for maybe a patient that's had a stroke and is not able to swallow, or they aspirate fluid. With enteral nutrition, it's more cost-effective, and with that, our care is to make sure the head of the bed is elevated so they don't aspirate that gevity into their lungs. The opposite of that is parenteral nutrition, and that's where it goes directly into the blood system. For some reason, their small intestine is not able to absorb, and they have malnutrition because of a GI system, usually in the small intestine. Or maybe they're unconscious, and it's going to be a long term. We need to really control the type of nutrition that they're getting. It goes into the bloodstream, so we either have to have a CVP, central venous line, or we need to have like a PICC line. We give lipids once a week, and we give the TPN on a daily basis. And the difference is, if you remember from nutrition class, the lipids are fat soluble and the liver will store them, where the TPN is your water soluble vitamins, and the body uses what it needs today, but then eliminates in the urine what is not needed. The parenteral nutrition is mixed by the pharmacist, and it's based off of the patient's weight, their output, their lab values. Do they need more albumin? Are they a little low in B6? Do we need some calcium? And then the amount of calories that the dietitian has determined along with the physician. So it's really a inter-collaboration process, how much they need. Looking at the differences, the enteral nutrition is put in with special tubing with a kangaroo pump. The kangaroo pump then can be set to run very slowly, or it can also give them more nutrition and a faster rate as they need. So the kangaroo pump goes with enteral nutrition. It's a special pump only for that. The parenteral nutrition that goes into the vein, just like if they were getting an IV, goes on the regular IV pump that we have. As you can see above on the right, for the parenteral nutrition that goes with the IV pump, the yellow, that's the vitamins. That's the color of the vitamin that is being administered right now for that patient into their CVP line. The enteral nutrition goes into the stomach or small intestine. It's called a PEG tube going into the stomach, or a G tube, G for gastrostomy. As you can see, the G tube then goes into the abdomen and just down below into that organ, so the nutrition can flow very easily into the GI system to provide their nutrition. Another medical terminology that goes with nutrition is gluco, and gluco means sugar. So when you see words like glucogenesis, it's the formation of glycogen from glucose. Our term cachexia means wasting away. A patient that has cachexia might be our patient with cancer or advanced stages of HIV, and the muscle, the tissue, the adipose, everything is wasting away due to lack of nutrition. And also with cachexia, there's a special way that they are decomposing through that process with with their disease. Active transport is a term that we use in nutrition, and we look at active transport taking energy or ATP to move substances in or out of cells that require that type of energy. Albumin is a protein that circulates in the blood. We know that albumin is that protein that transports minerals and drugs throughout the body, so it's kind of like a taxi cab. It helps maintain osmotic pressure in the body, and without enough albumin, we can see edema because the fluid seeps out through osmosis into the interstitial space, causing that edema. And then we know that albumin is made in the liver, and when you have a patient with cirrhosis of the liver or other liver conditions, we can see low albumin levels in the patient. Anemia goes with nutrition because the patient that doesn't get enough protein might be anemic. Anemia can also happen after a person has a hemorrhage or loss of blood. Maybe they are not making enough red blood cells due to a condition inside, or the spleen is destroying the red blood cells at a faster rate than should be. Your patient that's anemic is oftentimes very tired, pale, listless. They may have some shortness of breath or dyspnea with that as well, because the oxygen is not getting carried by the hemoglobin out to the tissues that need that. And just a couple of conditions or diseases that kind of fit with this nutrition unit. Celiac disease is the inability to digest gluten, which is a protein found in many of the foods we eat: barley, wheat, rye, and oats. A person with celiac disease has to avoid those types of products or foods because the microvilli in the small intestine get damaged or flattened when those foods are eaten. And with celiac disease, many times they will have malabsorption. Diarrhea is very common for the patient with celiac disease because those microvilli are not absorbing, and it's a very unhealthy situation. We're seeing a lot more celiac disease being diagnosed, and if you look at the grocery store, many of your foods will promote that they are gluten-free for all the people that have celiac disease. Even one of the local pizza parlors advertises they have gluten-free pizza. Failure to thrive is another condition to be aware of in the nutrition unit. It can be anywhere throughout the lifespan. Failure to thrive in the infant might be parents that it's a form of neglect. They don't feed the infant or know how to feed it. Perhaps they don't have enough money to buy the formula, and this baby's getting fed cow's milk and having a lot of allergies and intolerance to that. It might be that this child has some kind of defect in the GI system where they're not able to absorb. The parents are doing a great job feeding it, but it just is not absorbing the nutrients that it needs to. With that, my experience has been the doctor admits this child to the hospital. As nurses, we do a lot of teaching to the parents. We feed the child, we do daily weights, we check lab values to see, is this child getting the nutrition they need, or do we need to, maybe get social services involved. We also see failure to thrive in your older adult, that maybe they live alone, they have dementia, and they forget to eat and cook. So a variety of reasons can cause failure to thrive in your older adult as well. And a big part of that is just trying to figure out what we can do to get that turned around to provide adequate nutrition for our patients. So as we wrap up this nutrition unit for some further medical terminology, Potter and Perry is our resource, and also the images came from Google. Thank you and have a great day.